So in terms of limited access and limited infrastructure in developing areas as a barrier to the use of digital dentistry. Now, in the clinics where we work, those of us that are working in developing countries, think about what it will take to incorporate digital dentistry in your practice. Do you even have the basic equipment that you need right now? Do you have the basic equipment? Do you have, is your autoclave standard one? These are basic ones, these are not fancy equipment. You need an autoclave. Is it standard? You need your burners. Do you have, standard Bunsen burners, or you're having ancient and more ancient Bunsen burners that are not working very well? Are they even safe? Okay. What about your dental unit? Do you have a functional dental unit with all the elements in it working? Are you still doing scaling and polishing manually, or are you using ultrasonic scalers? Think about where you work. Have they been able to supply you with the basic things that you even need to work? Talk more of going digital. During coronavirus, I spoke to some of the practitioners in one country. Just for security reasons, I'm not going to mention that, in developing countries, one of the countries where you are from, and they told me that to even have hand gloves, okay, to even have hand gloves, that patients are now having to bring their own hand gloves to the clinic. I could not imagine how that can be possible, that a clinic will not be supplying sufficient hand gloves for the clinicians. Talk about a clinic that is unable to supply you with sufficient hand gloves to treat patients, and then you want them to bring digital technology for you. So that could be wishful thinking, you know that. So digital dentistry often consumes electricity. Okay, so all of these things going digital and all of that, you can have your dental unit. I remember during my internship years, we may have the dental unit, you're sitting on the fan, but there is on the fancy dental unit, but there is no electricity to even operate any of the things there. You still do everything manually. You are sweating because you can't even use the air conditioner or the fan. You have to open the windows for ventilation. The patient is struggling, you are struggling. Why? Because of high cost of electricity and unavailability of electricity supply for those people working in rural communities. The internet, what about the internet? Digital dentistry is high internet dependent. Do you have to be recharging your mobile phone to hotspot to the system, or do you have reliable internet supply? Have you got household modems that actually supply you internet? Have you got a intranet that runs through the system that can give you stable internet connections? You will require access to trained personnel. These are luxuries that a lot of countries cannot afford, a lot of clinics cannot afford in certain regions. The barriers that you see here is that there is high import duty on equipment in developing countries. So if you buy this equipment, they are not locally produced in the country where you are. You have to buy it from a more advanced countries, and you have to post that to where you are. And I did watch a video of someone listing out what it costs to import a car into one country. I will not say the name of that country, in West Africa. And they were saying to import a car, you need to pay you pay this import levy, you pay clearance levy, you pay manager's levy, you pay educational trust fund levy on an imported car. I was thinking, what does educational trust fund levy have to do with importing a car? You pay that, you pay environmental rehabilitation levy, you pay for everything. They were counting levies you pay to bring in a new car into this country in West Africa. I will not say what country it is, just for security reasons, but these are the issues that you can actually face importing digital equipment. So you might buy a digital equipment, but the cost of bringing it in might be almost equivalent to the cost of purchasing it in the first place. So these are things you need to be aware of and conscious of when you are thinking of going digital. Lack of technical support for the training centers. Like I said, you may not have, based on where you are, even if these things are given to you free of charge, you might not have enough money to go and learn how to use them, because you need technical support to use them. One thing I found, like in the UK, most clinics would function on hired equipment. Okay, so you can hire a dental setting. You are the clinician. You can be in charge of the consumables, but the main equipment may not belong to you. So the company that is supplying you with those equipment will also supply you with technical support. They will be coming around to look at any malfunction. They will fix it and all of that. But imagine if your equipment somewhere in Africa is supplied by people in China, or is supplied from Germany. Okay, so how are you going to get the technical support? Will you be transporting someone from Germany to Uganda to come and be maintaining those equipment, or are you going to bring them, or are you going to send people from Uganda to Germany to go and be trained on how to maintain those equipment? These are costs that people in developing countries need to be aware of when you're thinking about going digital. Inadequate internet bandwidth for cloud-based solutions can also be a problem. I've talked about internet, that you need very strong internet connections for you to be able to actually incorporate this in developing countries and rural communities. What impact will this have on your clinical practice? We say that it will widen the global disparity in oral health technologies. So when it comes to incorporation of oral health technology, there is going to be a lot of inequalities. There is inequalities now, but with the incorporation of digital technology, and now one part of the world can afford it, they can use it, they have the electricity, nobody's thinking about that, they have the internet, nobody's thinking about that, they just think about the cost which they can actually afford. They have companies that can loan them the money, and you that you are in a developing country, you have no access to electricity, you don't have reliable internet, and even if they give you those equipment for free, you still don't have maintenance and technical support. This will only widen the disadvantages, the inequalities in dental health outcome and the incorporation of dental technologies. There will be slower adoption in low-income countries. So you can see that we have looked at, when we started with technology, the use of digital technology in dentistry 25 years ago compared to this year. So, and we have said that most of the things that are now a norm in developed countries are still wishful thinking for people in developing countries. Okay, most dental clinics now in the developed countries will have intraoral scanners, whereas majority of dental clinics in developing countries will wish, some of them have not even heard about intraoral scanners. So you can see the gap, the divide that is there. An example is that a remote clinic may lack the bandwidth to transmit 3D scans to a central laboratory or access cloud-based imaging software for diagnosis. So you have a remote clinic where you are, and then let's say maybe there is one big clinic that have all this equipment in your state capital or your federal capital territory, and now you are in your own state, you need to do the work. Use an intraoral scanner, scan the system, send it to, let's say you are doing this in Umuahia, and you have to send it to a clinic in Abuja, where they will process it, do the work, and send it back to you, and you may not have the software capacity to transfer your system that far. Then that creates a problem for you. So moving past that, we look at ethical dilemmas and over-reliance on technology. We have 4 more minutes to finish this one. Ethical dilemmas and over-reliance on technology. So we can say that automation and AI-based decision-making can sometimes lead to clinicians to trust technology more than their own expertise, or ignore patient-specific factors. We say that you cannot become a medical doctor on Google. Google cannot teach you how to be a doctor. You need to go to medical school to learn how to be a doctor. You cannot use ChatGPT to become a dental technologist. Okay? Dental technologists learn in dental schools, not learn through generative AI and all of that. So when we incorporate this, we might fall victim of now thinking that these systems are wiser than we are, that these systems are more accurate than us. So you incorporate artificial intelligence in your system, and now you are relying on what the artificial intelligence is telling you without fact checking the information that you are getting, using your residual knowledge and wisdom as a trained clinician. Okay, the AI system, the technologies that you're using, they are coded with limited information while you are trained as a clinician. So you should be using them in assistive capacity, not relying on them for diagnostic accuracies. Okay, so we need to be conscious of that. That is one ethical dilemma. Some ethical concerns include misdiagnosis from flawed AI interpretation. So I don't know how many of you have watched a Netflix documentary on coded bias. Okay, so write that down, coded bias. I need you to go and watch a Netflix documentary on coded bias. It's not very long, it's a short documentary, but this will tell you how some of these systems are coded. You apply for a job. I don't know how many of you are applying for a job internationally. You apply for a job, there are some codes that they put in the system that will reject your application automatically without even looking at your skills. Okay, maybe the moment you put your location, if the system is coded to reject any person from a certain location or outside of a certain location, the moment you indicate your location, if whether you are the most qualified person, the system will reject you automatically, and you're wondering, why are they not even calling me back? This could be because of coded bias. So these systems are coded to respond to certain images and give you certain diagnostic output. They are not actually trained. The system have not gone to a dental school. Okay, your 3D scan did not go to dental school. You still need your wisdom as a professional to know that this scan is wrong. And for you to know that this scan is wrong, there is a malfunction in this scan, you need to know what the right way is. You need to know it manually for you to be able to use the technology efficiently. So these are some ethical dilemmas that you need to be aware of. There is loss of clinicians' judgment or critical thinking. So you need to still be able to use your own critical thinking skills, scrutinizing every output that you get from these technologies. So these are ethical dilemmas you should be aware of. Unequal access to high-tech care can create class divide. So you have people that are working in big clinics in the city, state capitals, and the federal capital territories, and they have access to all of these gigantic technologies, and they have or whatever support that they need because they're working in a federal clinic. And those of you that are working privately or working in a smaller state clinic or in a local clinic, you don't have access to this one. That creates a divide between the professionals instead of everybody actually being at the same level at the same time, and the profession generally will grow. You see that individuals are growing on their own. I think it is 11:40. This might be a good place for us to stop today because I have we have run over time. So we are going to stop here. There are some discussions that I have incorporated into this place, and we've not actually looked at the features of digital dentistry. So we are going to do this again on Saturday. Please tune in here, same station again. On Saturday we'll try to finish this off and go into the new things that we have for Saturday. So I will give 1 minute to see if anybody has any comments or questions to ask before we go. Thank you so much for coming.